For knee replacements, I do both standard instrumentation knee replacements and robotic knee replacements. Robotic knee replacements, everybody hears the term robot and they get excited about this. And so the cool part about a robotic knee replacement is I can help balance your soft tissue using the robot and a CT scan to help ensure that the knee that's going back in is going to feel as much like your knee as possible. Right now is a very exciting time for us at Ohio State, utilizing robotics for our total knee arthroplasty. I do use the Mako robot for a large portion of my knee replacements. There's a new exciting technology called the Think Surgical robot. It's a handheld robotic platform that allows us to dial in precise bone cuts to allow patients to have a knee that feels more like their knee. And we're one of the first institutions in the country to be using this technology, so it's very exciting.